Guys, let's move on the examination of the cardiovascular system. So during the cardiac examination, you start by undressing the patient from the neck to the waist. So you expose the chest and the abdomen. The position is 45 degrees or sitting position, and you inspect it from the side, the front, and the end of the bed. The examination is categorized into two parts, peripheral examination and cardiac. On the peripheral, you examine the hands, the legs, the pulse, you record the blood pressure, you examine the neck and the abdomen. Starting with the peripheral examination, you need to examine with, or you start with the hands and fingers. You look for finger crabbing, cyanosis, anemia, temperature, sweating, splinter hemorrhages, and the genuine lesions. From there, you come and palpate the pulse. There are different arteries which you need to palpate: radial arteries, brachial, carotid, femoral, popliteal, dorsalis pedis, and posterior tibial artery. But most of the time, radial artery is preferred. Now you come to the head or the face and you examine for the conjunctiva, for anemia. You examine the skin for cyanosis, that is peripheral cyanosis. Then you examine the mucous membrane, such as the lips and the tongue for cyanosis, and that is central cyanosis. This is a picture which shows the hand signs which we examine. This is a crabbing, drumstick-like fingers. This is colonychia. This is palmar erythema, splinter hemorrhages, ulcers node, and genuine lesion. Continue with the peripheries. You need to you measure and record the blood pressure. You can measure it while the patient is lying and while the patient is standing if necessary. Also, you need to examine the abdomen for hepatomegaly and ascites. The abdomen will be distended. Also, you need to check for edema from the legs and the sacrum. These coming to the pulse, you need to examine or you need to check to measure the pulse parameters such as the rate, the rhythm, the volume, the character, and the other radio present, such as synchronicity, radio to radio synchronicity, radio to brachial, radio to femoral, and the others. This is a picture which shows the physician examining the pulse of the patient, and he is examining the radio pulse. Continuing about the pulse rate normal is 60 to 100 beats per minute. More than 100 beats, that is tachycardia, and less than 60, that is bradycardia. Normal increase on inspiration and decrease on expiration, that is the sinus arrhythmia. The volume and the character, you can use the carotid artery, but most of the time the radial artery is used. Coming to the rhythm may be either regular or irregular. And the irregular part or the irregular parts may also be irregular, regular, or irregular, irregular. Now for regular, irregular one, this is when 1 in 4, there is a 1 in 4 dropped beats in second degree heartbreak, or 1 in 2 dropped beats in pulses beginning. I'm going to describe about pulses beginning in the next slide. Now for irregular, this occurs in atrial fibrillation and the ectopic pulses and premature pulses. Now this is the waveform which shows a normal pulse. There's a rising amplitude and a decrease, rising amplitude. Now this one shows pulses beginners, whereby there is a two beats which are close to each other, this one and this one. But the second one is weaker compared to the first one. And the second bit is due to premature contraction of the ventricles. So this kind of pulse is called the pulsus bigeminans. Uh, and the last one is called the pulsus alternans, whereby there is a alternation of a strong pulse and a weak pulse. Strong pulse and a weak pulse. That is called the pulsus alternans. Now coming to volume of the pulse, the volume is the movement imparted to finger and felt when gently palpating the pulse, and it corresponds to left ventricular stroke volume. Mhm. So the volume may be normal, increased, or decreased. If the volume is increased, this most of the time is seen is it is seen in high output states when there is an increased blood output from the heart, and it's seen in conditions like fever, anemia, thyrotoxicosis, and aortic incompetence. When the volume is decreased, um, this usually happens in states like shock, heart failure, aortic and mitral stenosis. I've already described about pulsus alternans. Now let's move forward to pulsus paradoxus. This is an exaggeration of usual decrease in pulse volume which occurs during inspiration. So during pulsus paradoxus, there is a decrease in pulse volume during inspiration, and it is confirmed by measuring the blood pressure. You will observe a decrease of blood pressure during inspiration of more than 15 millimeter of mercury. And that is pathological, and usually it occurs in severe asthma, pericardial effusion, and the cardiac tamponade. The character, the character is what gives a pulse its distinctiveness on palpation. Now there are different characters of the pulse. These ones are the examples of abnormal characters of the pulse. There is an acrotic pulse, meaning that it is a slow rising pulse and it occurs in aortic stenosis. There is also a collapsing pulse and it occurs in aortic incompetence. And there is also lastly a pulse bispherians. This is a double impulse palpable on each pulse and occurs in combination of aortic stenosis and aortic incompetence. This is just a picture which shows a different character of the pulse. You can observe it. Now, coming to the jugular venous pulse, if you want to examine this, you need to inspect the patient while lying at 45 degrees, look for a pulsation at the root of the neck, and inspect between the two heads of sternocleidomastoid muscle if you want to examine the internal jugular venous pulse. Mm. It is found between the two heads of the sternocleidomastoid muscle. Alternatively, you may use the external jugular vein, but only if you can demonstrate that it is open or patent. And the external jugular vein drops at a right angle, 90 degrees from angle of jaw or the angle of mandible. Method to examine the jugular venous pulse. First of all, you need to start first with the inspection of jugular venous pressure, followed by palpation. So you inspect the root of the neck for a visible pulsation if it is present. If pulsation is present, the following characteristic will help you to differentiate a venous pulse from arterial pulse. If it is a venous pulse, on inspection you will see a diffuse pulse and it will show a multiple waveform and it varies with respiration. Most often it will decrease during inspiration because there is an increase in chest cavity and which in turn increases venous return. So there's a decrease in the pulse decreases on inspiration. On palpation, you can occlude it by pressing your finger horizontally at the root of the neck, and there's a positive hepatojugular reflux. If it is an arterial pulse, on inspection, it will be localized, single waveform, no variation with respiration, and on palpation, you can't occlude it by pressing a finger horizontally at the root of the neck, and there is a negative hepatojugular reflux. This is how it is done, palpating the jugular